Stuart, do you want to come in on this point about consultant time and this difference in experience between, I think it was Kath Stansfield who brought this point to bear, that, you know, nurses have the time for this and consultants perhaps don't, if I've understood the point correctly?
Only to say that it's a major problem, really. The way that most NHS clinics are set up, certainly mine, is that they may get to time, but by the time you're halfway through them, you're running an hour late. There are 20 patients usually displaying unbelievable fortitude and patience in waiting to see you. You click into sort of survival mode, and you just think, well, we've got to get through this, and the patients have got to get seen. It's very difficult to find the time, and that's one of the reasons why change management is such a laborious process, really, because people are working very, very hard with limited freedom to change and improve what they do.
I think to follow up on that, you know, a lot of this information is driven by the patients, and if they have that information in a portal before you come into the consultation room, a lot of what Stuart says is taken away because the information is there. Kath Stansfield showed very nicely that you can have your green to red symptoms beforehand, so the patients have almost done half of the consultation for you, taking away, you know, I suppose the data acquisition aspects of nurse and doctor time, and there for the expertise and decision-making part.
So you're cutting straight to the chase, the important bit, that's where the value is added in that encounter.
Absolutely.
Do you want to comment on this, Cathryn?
Only to say that I think it's very important that there is some data that is captured in advance of the consultation, which we've just heard, and that some of the data can be put in retrospectively if busy clinicians can't find the time face-to-face. It's important that we don't do that terrible thing and terrible disservice to our patients by which we lose that patient face-to-face contact. We're so busy filling in the computer. Patients need our full attention in the clinic.
You would echo that, I'm guessing, from personal experience, Rosalind, you would echo that, the importance of that sort of focused encounter between you and the consultant or the doctor you're seeing.
Oh, it's extremely important. And plus, if you have all that information, like Kath said, on a data, you can actually possibly avoid going to the outpatients clinic. If you've got all that data in front of you and you know what's causing your relapses, you can actually avoid possibly going to see the consultant, which to me is perfect. It is a risk to do this, but patients have to come first. I'm not sure how they're going to fund it, where people are going to find the time for it, but something like this should have happened a long time ago. Mr. Russell was just saying about, you know, patients especially. Patients are very forthcoming now. You've got Get Your Belly Out, Crohn's and Colitis UK have got lots of patients on their website that are expressing their intimate details on Facebook. So really, you know, it's personally, regards of safety, it's worth the risk, and I think it definitely should be implemented as soon as we can.